So for the assessment, we're going to review the patient's record of care regarding the patient's ability to participate in the procedure. So include medical diagnosis, activity order, or any order specific to hygiene. Okay, so we're going to also assess the patients to determine if there are no concerns of a higher priority than hygiene. So this might be related to other basic needs such as toileting, fatigue, pain in level of sedation. So we're going to assess the skincare and other hygienic practices and any specific concern that might affect hygiene needs such as the presence of catheter or excessive perspiration from fever or dry skin. So we're going to also check to see whether special supplies or equipment are in the patient's room. So for the analysis, we need to critically think our data and carefully evaluate each aspect in relationship to other data. And then we're going to identify specific problems and modifications of the procedure needed for this individual. Okay, so we're going to do the planning. So for the planning, we're going to determine individualized outcomes related to mouth care. Okay, so for the plan procedure, we're going to consider the following. For the first one is type of hygiene needed. This might include the type of bath, oral care, hair care, and care for eyeglasses, contact lenses, and hearing aids. We're going to supplies needed, collecting those that are not in the room, and then assistance needed to accomplish the planned hygiene. Okay. So I already disinfect my hands and wash my hands to prevent the contamination of infection. So I'm going to introduce myself to our patient. So good morning, ma'am. By the way, I'm now Marlene Hope Claregor, your student nurse for today.
Good morning.
So ma'am, kindly state your name for me.
I am Leanne Grail Mangawa.
So what do you want me to call you?
Lee.
So ma'am Lee, I'm going to help you do the oral care. So I'm going to assess you in cleaning your mouth and as well your teeth. Is that okay with you, ma'am? Okay, so I already explained the procedure to our patient. So I'm going to close the door and pull the curtains around the bed. So I already closed the door, and for the privacy of our patient, we already done that. Okay, so we're going to raise the bed to an appropriate working position. So dahil hindi naman tayo nasa hospital, so nilagyan ko na lang ng pillow yung likod ng patient natin para parang makita na naka working position yung bed natin. Height, be certain the wheels. So we are going to check also the wheels if it's lock. Okay, we're going to start the procedure. So before that, I'm going to explain to you the materials. I'm going to introduce to you the materials. Okay, this is the clean water. We had a clean water. And then a water that she can use in washing her mouth. And then an improvised mouthwash. We had the toothpaste and the toothbrush. And then the dental floss. Okay, and as well we had bring the towel for our patient. Okay, so we're going to start. I already use my gloves. We're going to clean them out as follows. I'm going to place the towel under the patient chin across the chest of our patient. Okay, so I already put my gloves, and I'm going to moisten the toothbrush. And then spread a small amount of toothpaste. Okay, but before that, we're going to let the patient drink to moisten her mouth. Okay, and if there is no cleaning agent, we can use the mouthwash as substitute and also refreshes the breath. And also, well, you can use the saline or the sodium bicarbonate, the baking soda, also can be used if there is no available toothpaste. Any. So we're going to let the patient brush the teeth. Okay. We're going to brush, holding the brush at a 45-degree angle. And then I'm going to carry this. And then in a meses basin, we're going to vibrating the circular motion with the bristles of the junction of the teeth and gums. And we can use the same action on the front and back of the teeth. Let's start. Okay. Circular motion on the side. And as well at the side. You can also use at the back and in front of the Can spit it out, mom. Okay. And then we can also brush the teeth, the tongue of our patient outside. And then let the water okay. Then after that, we're going to wipe the patient. So after finishing, we're going to let the dental floss between the teeth. There is any left. Okay. Here. Okay, after that, I'm going to place it here and then wash the mouth of the patient. Okay, and then we had here a mouthwash, and we're going to add a water. Then okay, carry this up. And then we're going to wipe the mouth of our patient. And we're going to return the bed to the low position. I'm going to remove the pillow. Then in low position. And then I'm going to remove the towel and place it in a hamper or bag. Okay, then I'm going to care of the equipment and wash and disinfect my hands. So we're going to evaluate using the individual's outcomes criteria. So we're going to check her eyes. So her eyes are not red. And then eyes is held close by the iPad. And then patient express, ma'am, ma'am, are you comfortable with that position?
Yes.
Okay, so our patient expressed comfort. And then there is no indications of any adverse reaction. So there is, ma'am, may napipil ka ba na kakaiba, ganun? May masakit ba?
No.
Wala. So that is, there is no note any adverse reaction. So for the documentations, we're going to document eye procedure and any abnormal condition of the eye, and then add eye care to the nursing care plan.